And let's go live now to Sylvia Jones, who's making an announcement on hospital infrastructure.
Physicians, nurses, and volunteers here at Toronto General, and at all University Health Network sites for your dedication to providing exceptional care to Ontarians. You are all making a tremendous difference in the lives of Ontarians each and every day. And you are helping to build a stronger, collaborative, and more connected health system. As we continue to implement Ontario's plan to build, it's never been more important that our healthcare providers and frontline workers have the facilities they need to continue providing care for patients in a safe and comfortable environment. Investments in infrastructure projects help hospitals and community health providers make the necessary upgrades, repairs, and improvements to ensure they can continue delivering accessible and high-quality care for patients and families. So today, I am pleased to announce that our government is investing $182 million this year to support critical upgrades, repairs, and maintenance in 131 hospitals and 65 community health service providers across Ontario. This funding helps address three priority areas: health and safety, code compliance, and maintaining the integrity of our hospital facilities. Among other things, this funding will help our health system partners replace roofs and windows, upgrade heating, ventilation, and HVAC systems and backup generators, and meet the requirements under the Ontario Building and Fire Codes. As part of this funding, the University Health Network will receive $10 million to help address related issues across all of their sites. I know Kevin will share a few words afterwards about how this funding will help improve UHN sites for both patients and staff to further support the high-quality care provided by Ontario's hospitals. The government is providing an additional $827 million to hospitals across Ontario, representing a 4% increase from last year. This will ensure all publicly funded hospitals receive a minimum 2% increase to their budgets to help them better meet patient needs. We will continue to invest in patients, hospitals, and our frontline healthcare workers to ensure Ontarians continue to receive the care and services they need and deserve. In fact, Ontario's investments over the next 10 years will lead to $40 billion in health infrastructure improvements across the province. These investments will increase capacity in hospitals, build new healthcare facilities, and renew existing hospital and community health centers. Now, before I turn it back to Kevin, I want to speak to what is top of mind for many Ontarians. This year's cold, COVID-19, and flu season have been particularly challenging for our children, where we are seeing higher rates of RSV amongst those in their younger years. Today, I had the opportunity, or yesterday, my apologies, I had the opportunity to meet with the Children's Health Coalition, and I want to thank them for all the work they've been doing during this challenging time. We are continuing to work hand in hand with our pediatric partners to get through these challenging times. We anticipated a surge in our pediatric hospitals and took early steps to prepare. Ontario Health and our hospital partners developed surge plans, capacity plans, and we expanded bed capacity by 30%. We are building on these early efforts and continuing to work together. We have seen a level of collaboration among the entire healthcare system like never before. And for that, I want to thank Ontario Health and our hospital partners for coming together to protect our children this respiratory season. I also want to take this time to remind Ontarians that we need to get back to basics to protect ourselves and our loved ones as we spend more time indoors. Stay up to date with your vaccines. This includes your fall booster and your flu shot. I'm proud to say that tomorrow we are expected to reach another milestone of over 2 million fall booster doses administered. Screen for respiratory symptoms daily for yourself and your loved ones. Stay home if you're sick. Always practice good hand hygiene and wear a mask in indoor public settings. Our government is providing Ontarians with the tools they need to protect their families this cold and flu season. Thank you. Stay well. Merci. I'll now pass it back over to Kevin.
You've been listening live to Ontario's Health Minister Sylvia Jones at Toronto General Hospital this morning, announcing funding for hospital infrastructure, including $10 million to the University Health Network, as well as $827 million to hospitals across Ontario, which Minister Jones says is a 4% increase from last year.